One of my favorite models to help people with unwanted same-sex attraction is narrative therapy. That is what I practice in general, my primary model that I practice for helping people with any presenting issue. I'm pretty passionate about clinicians using what they know, starting with the models that they're already using and applying those to this presenting issue. A part of that is because they will definitely be practicing within their scope at that time. But anyway, one of the things that I love about narrative therapy for this presenting issue is that narrative therapy externalizes the problem. Narrative therapy externalizes the problem. It takes the problem from within the individual and makes it the problem is the problem, and it's not part of them. And that's perfect for this issue because the dominant cultural narrative is that same-sex attraction is your who, it's your identity, it's or gay and lesbian actually, and this allows people to start going, wait a minute, that is not my identity, that is the presenting issue, and that's the problem, perhaps the problem that they're presenting with. So I love narrative. There's a lot more to it, but I love narrative therapy for that purpose. One of the privileges of practicing from my perspective, again, narrative therapy, but also a biblical worldview, is that I privilege the client's values. And I have many, many clients that come to me because they know that I share their biblical worldview. And so finding that common ground of what, first of all, just because they're Christians doesn't mean that we have the same theology or we even have the same perspective on change or even the same perspective on understanding same-sex attraction. But I can go to where they are, and because we share a basic biblical worldview, they can build trust with me, and I can build a rapport with them quickly. And part of that is just being very upfront. When people ask me about my biblical worldview or my faith or whatever, I'm just completely upfront. Even when I'm interviewing somebody or they're interviewing me on the telephone before we have our first session, I'm clear, especially in the area of transgender right now, I'm clear that I am not going to participate with a delusion. I didn't do that when I worked with women with anorexia. I didn't participate with their delusion that they were fat, and I'm not going to participate with a delusion that someone is the opposite sex. It's not safe. It's unethical. And so if they're not okay with that, then they can find a different therapist. But anyway, so that's just being really who I am, being true to myself is a safety, even for people who don't believe like me. They feel safe with me because I'm not just flowing with the wind, and yet their values are centered, and that's very important to me. So neurodiverse youth are very vulnerable to the transgender ideology for various reasons. One of my theories has been that they grow up knowing that there's something different about them, and they're looking for answers. And the trans ideology has given them an answer. It's told them, oh, well, the problem is that the reason that you don't feel okay in your body is because you're actually the opposite sex. That's a simplification of it, but what we're finding in the research is that they are vulnerable to the black and white thinking. They're vulnerable to sensory problems, and as they enter puberty and their body is changing, they're extra uncomfortable with their bodies. A lot of youth are. A lot of adolescents are uncomfortable with these changes. It's explosive for them. It can be very uncomfortable, and so they will naturally gravitate toward, oh, I would love to be. I mean, if I don't have to be this sex, I could be the opposite sex. That's great. I want to do that because that's going to help me. The other thing that I think is really important to understand about many kids on the autism spectrum is that they are very rigid thinkers, very black and white thinkers. So they are vulnerable to the sexist stereotypes. So for example, a little girl, I really love mechanics, so it must mean I'm a boy. And of course, in my opinion, trans would not exist without sexist stereotypes, but they're very vulnerable to those. One of the courses that we're presenting at the conference this year is our very first course for our research certification. So this is an opportunity for me to introduce that course. It is on evaluating research. I'm passionate about clinicians and pastoral care workers learning how to take an article and critically evaluate it to understand where the biases might be. Many times the conclusions, and maybe not even of the researchers themselves, but of professional organizations attempting to create practice guidelines. They look at the data or the conclusions of the authors and go, oh, okay, this justifies our practice guidelines. But if you look deeper, and of course, if you're interested in doing that, I would say Paul Solin's work is the best out there to look deeper into some of the research and finding out what it actually says. But also, if you want to learn how to do this yourself as a clinician, stay tuned to the Introduction to Evaluating Research course that we're going to have in the curriculum, because it helps you look at the biases. It helps you the recruiting efforts. If recruiting is poor, you might as well throw the thing out. And we have a lot of biased recruiting efforts in this research. If you look at how the protocol that they're using, or even the definition of terms, oftentimes you'll find in the research that tries to disprove that people can autonomously influence their own sexuality. In that research, they oftentimes will conflate therapy with support groups. They put it all in one, and then they say, oh, look, safety or sexual attraction, fluidity, exploration, and therapy doesn't work, and they're not even measuring that. So look at how they define terms. Make sure that they're really careful about that. I find that in the research on marriage, oftentimes they include cohabiting couples when they're researching marriage, completely different animals. And so that's, just be a critical thinker and get help. There's lots of books out there, articles on how to evaluate research too. And as clinicians, we are ethically bound to continue to look at the research and find out what is true, and what we can say about our practice, how we can practice ethically and effectively.